First, greet the patient. Introduce yourself and your examiner. Explain regarding the examination and ask for permission to proceed. Ask the patient for the presence of pain. The patient should be positioned comfortably supine at 45 degrees or sitting with the chest adequately but modestly exposed. Wash your hands before you proceed further. Now we move on to the general examination. Spend a few seconds observing the patient from the end of the bed. A useful method of general examination is the 4-3-2 rules as shown in this table. Regarding nutrition status, it can be described as cachectic, thin, normal build, or obese. Look for any medical devices near the patient's bed and inspect them. If there is a bedside drawer, ask the patient's permission to inspect it. Now we move on to the peripheral examination. Stand on the patient's right side. Ask the patient to raise both his arms straight in front of him. Raise the patient's hands to your eye level and check for finger clubbing. Repeat this with the other hand. Inspect the dorsum part of the hand, paying attention to the nails to look for nicotine staining. Now ask the patient to turn both palms upwards. Compare the patient's palms and yours to look for cyanosis, pallor, or erythema. Feel the palms for sweatiness and warmth. Now feel the patient's right radial pulse. Assess for rate, rhythm, and volume. Count the respiratory rate. Spend at least 30 seconds to count it. Next, we need to check for fine and flapping tremors. Ask the patient to raise both arms straight in front and slightly dorsiflex both hands. Observe for any tremors. Do the enforcement maneuver like so to detect flapping tremor. Inspect the arms for any scars, IV lines, and BCG scar. Inspect the eyes for the presence of pallor or jaundice. Using a pen torch, inspect the oral cavity and tongue. Look for oral thrush, central cyanosis, and mucosal dryness. Check the trachea position by tracing it from the thyroid cartilage down to the suprasternal notch. Then, using your index and long finger, gently check for tracheal deviation. The trachea will be slightly deviated to the right in the normal population. Quickly look at the right side of the neck for any rise in JVP. Remember to do this while the patient is supine at 45 degrees. Next is the specific examination of the chest. Remember the mnemonic: look, feel, tap, and listen to orientate yourself during the examination. First, we need to look. Inspect the anterior and lateral side of the chest for any scars or visible abnormalities. Then we need to feel. Assess the chest expansion over 3 zones. These are the upper, middle, and lower zones. For the upper zone, you check for anterior, posterior movement of the thumbs. For the middle and lower zones, you look for lateral movement of the thumbs. Grab the sides of the chest wall as much as possible. Approximate both of your hands so that your thumbs barely touches each other. Ask the patient to breathe in deeply and breathe out while looking at the degree of movement of your thumbs relative to each other. Now we proceed with vocal fragmentous examination. Ask the patient to say 99 while placing both palms or sides of the hands on the chest wall. Compare the vibration felt on both sides of the chest. Next, we proceed with the tap component. This is the percussion. Remember to strike using wrist movement, not using the elbow movement. Start by percussing the right supraclavicular region, then to the left supraclavicular area. Tap lightly on both clavicles to look for any pain. Continue the percussion of the remaining part of the chest wall in a crossing over and downward movement at the mid-clavicular line. Do not forget to percuss over the liver and cardiac area as well as the lateral side of the chest wall. Now we move on to the listen component, which is the auscultation. Using the bell of the stethoscope and pressing it firmly to the chest wall, listen over both supraclavicular areas. Ask the patient to breathe deeply at a normal rate. You can ask the patient to breathe through his mouth to accentuate the breath sound. Finish the auscultation using the diaphragm in a crossover and downward movement at the mid-clavicular line except at the cardiac area, whereby you need to auscultate lateral to the mid-clavicular line. Do not forget to auscultate the lateral sides of the chest wall. Now we have come to the last part of the listen component, which is the vocal resonance. Ask the patient to say 99 while auscultating over the chest wall. Use the bell over the supraclavicular areas and the diaphragm over the other areas. The auscultation points are similar as before. We have finished examining the anterior chest wall. Now, we move on to the posterior part of the chest wall. Ask the patient to sit up and turn to the left facing the wall or the window next to him. Repeat the technique we used earlier for the anterior chest wall. Remember, look, feel, tap, and listen. Inspect for any scars or lumps. Check for vertebral tenderness and sacral edema. Ask the patient to cross his arms with hands over his shoulders to abduct the scapula. You can also ask the patient to hug the pillow. Do the chest expansion maneuver, but this time only the middle and lower zone. Similar to the anterior wall examination, you look for a lateral movement of the thumbs. Proceed with vocal parameters over the upper, middle, and lower zones. Next, proceed with percussion. Remember to tap using wrist movements. Stick to the scapula line while tapping. Compare the sounds from both sides. Percussion sound can be resonant, hyperresonant, dull, or stony dull. Do not forget to tap at the bases and lateral chest wall. The auscultation of the posterior chest wall is similar to the anterior chest wall. Auscultate using the diaphragm over the scapular line, starting from the left or right upper zone in a crossing over and downward movement. Listen for the presence of breath sound and its character. Compare the breath sound heard over both sides. Listen for additional sounds such as fine crabs or cross crabs, wheeze, rhonchi, and pleural rub. Most doctors tend to miss the lung bases. Always remember to listen to these areas as subtle signs such as fine crabs or minimal pleural effusion can be missed. Pleural rub is best heard over the lateral chest wall. It is similar in character to fine crabs, except that it is heard both during inspiration and expiration. Fine crabs is heard only in inspiration. Vocal resonance assessment of the posterior wall is also similar to the anterior wall. Ask the patient to say 99. Start from the upper zone, then move in the diaphragm in a crossing over and downward movement. Compare the sound heard on both sides. Remember to check the bases and lateral chest wall. Check the cervical lymph nodes over 8 regions: submental, submandibular, deep cervical, superficial cervical, supraclavicular, preauricular, posterior auricular, and the occipital area. Next, reposition the patient to the initial position. Check for pedal edema by pressing at the medial part of both ankles. Remember to look at the patient's face while pressing. Check the level of pitting edema if present. Now, we have come to the final step, which is the conclusion. Thank the patient, redress the patient, prepare to present your findings if you are in the exam. Now, I will show how quick you can do all the steps within 8 minutes.
Assalamualaikum. Nama saya Dr. Jazman. Saya Profesor Bagi Dalam ini. Boleh saya cek sikit mana-mana? Ada nanti. Nanti kita cek ada dan jika sikit ada betul-betul isi dan boleh saya buka laci? Okey, buat kanan macam ni. sana macam ni. Pusat. Letak tangan. Letak bawah. Buat tangan macam ni. Saya tekan sikit ya. Letak bawah. Tangan sikit. Dekat mata ke atas. Dekat sini. Sini. Mana mulut dah luas? Dah luas. Buat A. Dekat lidah. Okay, saya tekan sikit lah. Dekat ni. Agak saya tak selesa sikit lah. Bila jangan rasa tak sakit. Okay, simple sini sikit. Terima kasih. Ada sakit mana-mana kat kawan? Ada. Okay. Dia letak tangan kat dada. Kita nafas. Lepas. Tarik. Lepas. Bagus. Ada sakit ke? Tak. Kita nafas. Lepas. Tarik. Lepas. Tarik. Lepas. Tarik. Lepas. 99. Sakit ke? Tarik nafas. Cik boleh bangun dan menghadap sana. Okey. Dapat di sini. Boleh silakan nak tahu. Macam ni. Sakit kan? Atas. Lepas. Tarik. Lepas. Bagus. Tarik. Lepas. Tarik. Bagus. Cukup 99. 99. Masih lagi di atas ya, jangan gerak. Nafas. Nafas. Okey. Jangan letak turun. Okey, tarik. Okey, terima kasih. Kita pakai baju lagi.